Prostate Biopsy. Introduction. The prostate makes fluid that makes up most of semen. Select true or false. Correct. Semen is the white fluid in which sperm travel. A prostate biopsy is the only way to diagnose prostate cancer. Select true or false. Correct. Prostate biopsies are often performed after other tests show the possibility of prostate cancer. You may need to take an enema before your prostate biopsy. Select true or false. Correct. An enema is a liquid medicine inserted into the rectum to help clear the rectum for the biopsy. A transrectal biopsy is the most common method of prostate biopsy. Select true or false. Correct. A transrectal biopsy uses a needle inserted through the rectum into the prostate gland to collect tissue samples. Dan has a fever after his prostate biopsy. His biopsy site has been painful and the pain has not gone away. Should Dan contact his healthcare provider? Select yes or no. Correct. Fever and pain that does not go away may be signs of a problem. Dan should contact his healthcare provider. Is it unusual to have blood in your urine or stool after a prostate biopsy? Select yes or no. Correct. This is normal and usually goes away after a few days. Blood in the semen is also common for a few weeks after a prostate biopsy. Thank you for using Explain.